All right, Dr. Rollins joins us once again, and today we're discussing cell phones and their relation to cancer. We've seen a lot about this in the news, and you're going to discuss how that exactly occurs.
Yeah, there's just another study came out just recently in Sweden, linking excessive use of, anybody got one of these? You know what this one is, don't you? Linking cell phones to increased risk of brain cancer.
Sure.
Now, they found a slight increased risk even with more than 1 year of use, but in groups that had used it for more than 20 years, there was about a 3-fold or 3 times increased risk of brain cancer.
Wow.
Now, there have been a couple other studies in Europe and in United Kingdom that didn't show a link to brain cancer. There's been some controversy about this, so I don't think the jury's completely out on it. But this last study was pretty conclusive, and it was a pretty good study, so it should give us pause. I'll mention in the last 4 or 5 years, there's been a few other studies. One of them really conclusively linked cell phones to changing the rhythm in the heart. And that was one of the first studies that showed, yes, cell phones will influence biology. Another study showed in young men that carry cell phones in their front pocket, they had decreased sperm counts and decreased fertility. So we're getting more and more evidence that, yes, the microwaves from cell phones do influence human biology and human tissue.
Okay, so it's mainly the microwaves that are doing all this damage?
It's the microwaves. And they don't know, exactly how this happens, but there's some evidence that it may interfere with DNA replication. It may increase oxidation in the tissues that are close to it, and oxidants can cause damage. It can promote cancers. So what do we do other than not use a cell phone? One of the best things, I think, the bottom line is there's a lot of energy coming right here.
Sure.
So if you put this right close, that's not cool. So I think using headphones that plug in is probably one step better, because you're away from the actual receiver here.
Sure.
Using the speaker and holding it out has been recommended. There are devices that you can put onto a cell phone that purportedly block some of the risk with the microwaves. I'm not an expert on how well those work. Yeah. So I think probably for now the safest thing, A, is not to use your cell phone so much, or to text or to keep it away from you is probably good advice.
Okay, so maybe it's kind of natural for people to just put it in their pocket, maybe keep it away from you, even though that might be a hard habit to break. But
I think so. There's similar thoughts about, like when we sleep in our bedroom, we should not have a lot of electronic stuff around us. Living where you're close to large electrical panels has been suspect. So we know, the bottom line is electrical current or electromagnetic frequencies, microwaves in this case, do influence tissue biology. How much is we're just beginning to learn. So it's probably a good idea to keep your distance.
Yeah, well, we're not getting rid of cell phones anytime soon, so definitely adapt to that to keep yourself healthy. If you have any questions for Dr. Rollins, feel free to visit him or call that phone number right there on your screen. Thanks for joining us.
Thank you.
We'll be right back.